according to the budget documents in your earlier testimony, and as stated here by several, we're looking at about $492 million in supplementals and another $308 in deferred payments, totaling about it's $900 million in cost overruns, and then a projection next year requesting an additional $1 billion. Just in the previous testimony, as a representative had stated, projecting the same number of folks in the Community Health Choices program, knowing that we're going to have massive growth there. If all that funding is met, are we still going to be sitting here next year looking at $900 million in overruns in this department? And if so, what can we do to better manage these cost overruns? And if we're under projecting in this one population in the Community Health Choices for seniors, is that because we're overspending in other areas?
So, I mean, to answer your question about what we can do to try to address cost, you know, I do think I mentioned earlier that one of our real success stories has been CHC. Even though it is a new program, so I think anticipating exactly how many people we're going to serve and what their acuity is going to look like is challenging. At the same time, we have seen CHC impact where people are receiving services. So we are serving more people in the community where it is cheaper to provide those services. So I think that's a good thing. I mentioned earlier also that, you know, we're looking at the efficiency adjustments, which are significant. I mentioned that in our physical health program, we've taken $1 billion out of our rates over the last 5 years. We're now looking at how we can apply those to our behavioral health and our CHC programs. So I think we are trying to figure out how we can contain these costs going forward without having a negative impact, of course, on the people that need these services.
I mean, right now, currently 40% of the state budget is the Department of Human Services. And now with this $1 billion increase next year, $1 billion to fill this shortfall from this year, and then maybe another $1 billion next year. At the end of the, you know, these programs continue to grow, and yet, you know, the tax base and the taxpayers are limited to what they can support in these programs. We hear from every other department when they come in this week saying they need more revenue for this, $1 billion for schools, and all these other programs. And yet, you know, I think there needs to be a little bit more focus on where we can cost save and a little bit better projections, as earlier stated, so we can plan accordingly in budget. It's very important that when this body passes a budget, that those departments follow those. It's a legal binding issue. I understand there's going to be cost overruns because there's some mandated care and some federal money that has to go along with that. However, $1 billion. 900 million is close to $1 billion. That's a significant cost overrun. With that said, I heard statements earlier, and I don't know that the administration proposed it, but there are proposals to provide CHIP and SNAP benefits for those that might be here undocumented or illegal immigrants. Is that legal to provide CHIP or SNAP benefits using federal dollars?
And just to be clear, that's not in the governor's budget. So okay. I answered questions about that, but that's not part of the governor's budget.
Okay. So, I mean, I would say that as we move forward, it's very important. As you stated earlier, these senior citizens that are coming in and need these services, they paid in. They are residents. We have an obligation to take care of them. It would be nice to take care of other nations, but we also need to make sure that we're providing this funding and the necessary level of care for the residents that are here before we can expand that access to anybody else. One other question that I had, and I have a little bit of time left. DHS rejected $60 million in federal money that would have went to the certified community behavioral health centers. And that's $60 million that we didn't take from the federal government. What was the reasoning behind that when we see such an issue with behavioral health in our communities, and it was talked about earlier? Why would we turn that money away?
Right. So we ended our participation in the CCBHC program effective last year. There were discussions of kind of an elusive 2-year extension on this program that just never materialized. And of course, it's important to know that these aren't just free federal dollars. We have to have a state match. So we draw down federal funds.
What was the state match on that $60 million?
Do you know what the state match was?
I don't know.
We could get that for you.
Was it half, or was it 20 million, 13 million?
We'll get that for you. But again, we had to put state dollars up, and I think what we saw, again, we we didn't know what was going to happen with the federal program long term. So rather than put ourselves on the hook for something that may not ever materialize and still hasn't materialized in terms of a 2-year extension, it's continued to be re-upped for a couple weeks at a time, a couple months at a time, but we've had no long-term plan from the federal government. And also, the primary goal of this program was to facilitate care coordination and to better coordinate care. And what we found is, so the idea was, let's provide more services in one visit and really coordinate that care. And when we looked at the data that we got from the providers that we were contracting with, what we found is that really wasn't happening. The average number of services provided was, I think, 1.16. So we weren't seeing that care coordination that we were in theory paying for. And this was also a lot of money that was going to a very few number of providers. This was $50 million that was going to 6 providers. So the way that program was operating, it wasn't something, especially given the budget challenges that we've been talking about, it wasn't something we were going to be able to scale.
With that being said, and I know this is my last statement because I got the little red light. With that being said, to turn away $60 million in federal money that could have went to behavioral health here in the state of, or in our Commonwealth, when we heard earlier about just cuts and everything else, and I hear about needing more money, couldn't the department have done a better job to manage that money and continue to get it rather than to just turn it away? And that's my closing thought. Thank you.